We are back on a Saturday morning with more on Chadwick Boseman's passing. The actor died after a 4-year, very private battle with colon cancer, and he was just 43 years old.
This is bringing to light, of course, the importance of screening and knowing the warning signs of colon cancer. And for that conversation, we want to bring in NBC's medical correspondent. Our friend Dr. Torres joins us this morning. Dr. Torres, we appreciate your time this morning. This was such a stunning loss for so many reasons, but it does really raise new attention as it relates to colon cancer here. What are the warning signs that Americans, that individuals should be looking for as it relates to this awful disease?
And good morning. And it's important that they look for these warning signs because the sooner you can treat colon cancer, like most cancers, the more successful it is, the easier it is to treat, and the more likely you are to recover from it. But here's some of the warning signs that we look at when it comes to colon cancer. Any kind of change in bowel habit, that's one of the important things. And these might be subtle changes, so keep an eye on your body and what's happening there. Bleeding, especially rectal bleeding, any blood in your stools. If you have cramping or fatigue or an unexplained weight loss, these are important clues that something could be going on. But one thing to remember, too, is these are clues that happen once colon cancer gets to a more advanced stage. You want to catch it earlier if possible, and that's simply with screenings.
Well, yeah, let me follow up on that, Dr. Torres, because there is new guidance from the American Cancer Society. When should people be getting screened?
Right, the American Cancer Society just dropped the age for screening down to 45 and above. And so people starting at age 45 sooner if you have any of those signs, if you have a family history. The CDC still goes with age 50, but there has been some recommendations to lower that age because we're seeing an increased rate of colon cancer in young people. Even as young as 20, we're seeing more cases over the last few years. Not exactly sure why that's happening, but they want to try and catch those early on with these types of screenings.
Of course, Chadwick Boseman was just 43 when he passed, had been fighting this privately for about 4 years now. As we discuss this issue more broadly, does this happen more frequently in particular communities? It seems to happen more often in the African-American community, doesn't it?
It does, but overall, colon cancer is the third most leading cause of cancer in adults. It's the second leading cause of cancer-related deaths. Unfortunately, African Americans are at the high end of that. They're the ones most likely to get colon cancer and to get an aggressive type of colon cancer that's much harder to treat. We're not exactly sure why that happens, but we think part of that reason might be because of lack of screening, lack of access, and we know that needs to be corrected as well. So hopefully this message gets out and people understand what they need to do in order to protect themselves.
Yeah, it's an important conversation for so many reasons. Dr. Torres, we appreciate your expertise.